All right, so what first pulled you into medicine?
So medicine completely, I knew at 5 years old that I was going to be a nurse, or in medicine in general. My papa was sick and he was living with us at that time. And so I would do all of his wound care and stuff at 5 years old. And so I've had multiple doctor sets and everything. So since then, and then I, at first I thought I wanted to be a physical therapist, but then that changed a little bit once I got into school, found my love for nursing and actually doing more hands-on care. And then from there, if you would have told me I was going to be a nurse practitioner during nursing school, I would have laughed at you. But I wanted to have a little bit more autonomy and be able to actually treat my patients and make more of a difference than more or less just following orders from the doctor. So I went on to NP school, and then I kind of fell in love with more of the preventative medicine. I just felt that our system right now is really broken and we just treat very reactory. And so preventative medicine is kind of where I felt my calling to. And then at the root of all preventive medicine is really hormone treatment. So when I was coming out of NP school was actually at the front of COVID. So I graduated nurse practitioner school 2019. COVID happened like 2 months after that. So, and I was working in the ER as an RN at that point in time. So I was seeing kind of the front lines of how sick everybody was and then how sick people were whenever they were not taking care of themselves. Like the people that were healthy, they were doing okay with COVID, but the ones weren't so much. Like looking at the patients like going through COVID and stuff, that was kind of eye-opening that we have a very sick nation. And if we could somehow catch these people before they started getting sick, there could be better outcomes later down in their lives. That was more trying to catch it at the front versus treating it after it's already happened. Getting back to the base of everything. The hormones are the root of so many different things. Like checking your labs and staying on top of things, being active, eating correctly, that's all fantastic. But hormones kind of are the root cause of, or the root issue for a lot of different things. And so that is something I kind of wanted to start treating. And then in modern day medicine, I feel like all we do right now is throw medicine at everybody. And that's what they're taught. Like that's what we're taught in school. That's what I'm taught. Like all the medical doctors, that's what they're taught in school too, is this person has a problem, let's treat it with this medicine. Instead of this person has the problem, let's figure out why they have the problem first. And so I feel like we were just throwing meds to then keep throwing medications at people versus treating the actual root cause of the problem, which makes a lot more sense in my head to actually do something like that. Something that surprised me the most was the low levels of people. I mean, I've read it in literature that yes, we have decreasing levels of testosterone in young men, but in practice, my guys that are 50 to 60 years old, they have way better levels than my guys that are in their 30s to 40s. We're having to start treatment so much earlier for them to feel good. And it's just shocking. That was honestly shocking to me at how low those levels were for the guys in their 30s when they should be technically almost at their prime at that point. And so some of the different things that I'm seeing like testosterone helping them with is more like the emotional side of things, that they weren't like most guys, they were like, okay, I'm going to get big and buff or perform better in bed or whatever it might be. But like it's helping out with like their anxiousness or their stress levels, because we all also work really high stress jobs. Everyone is very stressed out, cortisol levels. And so that's what I'm seeing is a more relaxed, calm personality with my guys that are being treated with that, when the stigma is that they're supposed to get roid rage and kind of act crazy on this medication, which is just that, a stigma, which is not actually what happens. I think the hormone optimization is kind of seen as, I don't know, it just has a bad cloud around it for whatever reason. And it shouldn't. It has an effect on so many different things in someone's life that I don't see why that wouldn't be like one of the first things that we look at versus, checking all these other labs, or once again, just tossing a med at it. If someone comes in with a complaint, we should be trying to figure out why they have that complaint, but then hormones can help out with so many different things. If we can optimize those first, we can avoid more of like the synthetic drugs that we're putting into our bodies versus a natural bioidentical hormone that is what our body needs. In my idea, good care is where the patient is getting a treatment plan that is for themselves. They are not having to make it work in a certain protocol or anything like that. It's individualized care. Also where they don't have to worry about it, where they're told up front that like the different risks and stuff like that. They're in the shared decision-making process. It's not me just saying you have to have this in this dose. It is us talking through that, what works best for them and their lifestyle. The patient that I'm looking for is someone that's trying to better themselves, or they're kind of seeing the writing on the wall with our modern medicine that this is not the cure-all. That are just wanting to help have more longevity. That is their goal. It would not be trying to quick gains in the gym or cycling everything. There is a time and place for that for some people, but for me, I want somebody that is in it for the long haul and trying to better themselves in this medicine, help them out with that. I would like people to think of my clinic as a place that they can go and be comfortable at, where they can get personalized care, good care, and then easy. Like does not need to be hard. There does not need to be multiple hoops that you should have to go through to get started on some sort of care. Like I want this to be a seamless process for everybody where they can get the medication and the care that they need in an easy process. If you're struggling to figure out what your next steps need to be, come in for a consult. That is all that needs to happen. This does not need to be any high pressure situation. I want you to come in and see if this is a right fit for you, if this is even what you want to do. I don't throw testosterone every person that comes in here. It has to be right for you and your lifestyle and what your goals are. This is not some sort of pushy area that I'm going to be forcing testosterone down your throat or any sort of thing like that. I want you to be your best optimized self. And if that's with me and with testosterone, that would be great. But if it's not, it's not. I feel like my patients trust me because they know that I have their best interest in mind. I want to do what is best for the patient. I truly care about the patient, and my goal would be to help make them their best self. I decided to open my clinic because I saw there was a need. There is so many clinics that I've seen that just work by protocols versus what's best for the patient, or that this is such an underserved community anyways. A lot of guys don't want to admit that they have a testosterone issue or that they are not feeling this way. I want you to be able to come in and talk with me about anything, but this is like how you can live longer is how I look at this. This is meant for the long term, like for you to have a better life, like with your family, with your children, with your wife, whomever. I went into this because there was just such a need for it. I've just been seeing too many guys run down. Like personally, my husband's on this and it's helped him out a lot, helped out our marriage. I just think it's kind of life-changing for a lot of guys. And so I felt like that was something they would really need and could benefit from. And then it's something I enjoy. I get to sit and talk and really actually see that I'm changing lives versus me clicking buttons with some other company just because that's what I'm supposed to do versus the protocol.